Ebola virus disease kills up to 90% of the people who catch it. There is much we don't know about the virus, like where exactly it originates, or how to cure it. Here's what we do know about how the Ebola virus works. There are 5 species of Ebola virus, 4 of which cause disease in humans. People often contract it through the preparation of bush meat, animals such as monkeys or bats that are trapped by hunters in African forests. Once Ebola enters a human's bloodstream, researchers believe the virus secretes a protein that hides it from antibodies, allowing the virus to replicate and spread throughout the body. Initial symptoms of Ebola are similar to those of other viruses. Early on, infected people develop a fever, severe headaches, and a loss of appetite. Soon, the virus causes blood clots and often internal bleeding from major organs. Then comes vomiting and diarrhea. As the disease enters its final stages, a skin rash breaks out, and blood can seep out through a patient's eyes, nose, and mouth. Death generally results from shock or multiple organ failure. In all, more than 2,300 people have died from the Ebola virus since it was first found in Central Africa in 1976. Typically, more people have died from the flu each year in the U.S. alone. But the latest Ebola outbreak is the worst in history, and the U.S. government has responded with a high-level warning against non-essential travel to certain countries in West Africa.
Ese es el que lo van agarrando. Ese.
¿El de los guantes?
Sí, de los guantes.
As we said, Emory doctors are now waiting for the arrival of the second American infected with Ebola, Nancy Wright-Ball, who is also, she will also be transferred via the same plane from Liberia. According to the relief agency, Samaritan's Purse, which is affiliated with the two volunteers, the exact timeline and travel route for Wright-Ball are being kept confidential to respect her privacy. Now, the same was also done for Dr. Brantly. But with that said, we do know some of the details of this morning's flight. It made a stop in Bangor, Maine, en route to Atlanta. The city's mayor confirmed the jet landed briefly to refuel before going on and arriving at Dobbins Air Reserve Base.
From the time it left Cartersville on Thursday, it took 2 days for the specially equipped Gulfstream jet to return here to Dobbins Air Reserve Base. The plane landed shortly after 11 a.m. and it took another hour to transfer Dr. Kent Brantly to an ambulance. Once that was completed, the jet was back on the runway, heading in the opposite direction, back to Liberia to pick up a second patient, Nancy Wright-Ball. And if the timing is the same, we should expect her back here in the Gulf Stream Monday or Tuesday. Reporting from Dobbins Air Reserve Base, I'm Kevin Rosen for 11 Alive News.